Health Coalition, which is a coalition of students, healthcare workers, academics, researchers, and most importantly, frontline workers. The Canadian Health Coalition has been working on Pharmacare, the National Public Drug Plan, for over 2 decades. And I'm here today with friends and allies to make a point that it's time that we had a national public drug plan. It's actually beyond time. 1 in 5 Canadians cannot afford their prescription medications. And we know, as registered nurses and other healthcare workers, that a filled prescription is an empty emergency room seat. We also know that our emergency rooms are full to overflowing. So this would be one step towards better health for everyone. Our polling also shows that 9 in 10 Canadians want a national public drug plan, Pharmacare. So it's time that the politicians got caught up to the people of Canada. In 2019, Dr. Eric Hoskins was commissioned to write a report about the implementation of a Pharmacare plan nationwide. Now, it's up to all parties sitting in the House of Commons to implement that plan. It's sitting on the shelf collecting dust, and people are dying. Approximately 300 people annually die early because of lack of access to proper medications. Pharmacare, it saves money, and it saves lives too. It's really a win-win-win. It's a win for the federal government, creating a legacy for those who introduced it. It's a win for the provinces because it's been taken off their budget sheet. And most importantly, it's a win for the people of Canada. So I'll turn it over to Siobhan Vipond.
Good morning. I am Siobhan Vipond, Executive Vice President of the Canadian Labour Congress. We are calling on the government to deliver on its promise to introduce the Pharmacare Act without further delay. Everyone is affected by the rising costs of food, housing, medications, and other essentials. More than 1 million Canadians are cutting back on food and home heating in order to pay for their medication, and another million are having to borrow money. There is a clear urgency. People need a publicly, universal, publicly funded, and publicly delivered Pharmacare program. Now, the government is already, has the blueprints in hand. They can implement it, and there's absolutely no reason why they haven't set the plan in motion already. Now, despite inflation moderating, people are still being forced to make difficult choices. Should they buy food to put on their table, or should they buy their medication? And no one should ever have that difficult decision, especially here in a rich country like we have in Canada. Universal coverage for some essential medicines was supposed to be in place in January 2022. That's a full year ago. And the government, if the government had followed their own blueprint. And here we are, a year later, and Canadians still don't have access to life-saving medicines. Now, what is shocking to me is that in 2021, Canada spent more money on prescription drugs than on doctors. So we are urging the government to stop delaying and pass the Canada Pharmacare Act by July 1st and fast-track the plan for bulk purchasing of prescription drugs and the implementation of the initial phase of the Universal Public Pharmacare Essential Medicines. This will really help all Canadians. This is about strengthening and expanding our public care system. This is about investing in Canadians. Over to you.
Thanks. My name is Nik Barry-Shaw. I'm a campaigner with the Council of Canadians. We've never needed Pharmacare more urgently than we do now. Canadians are struggling to fill their prescriptions. Millions more are struggling with high drug prices, and sky-high drug costs are draining billions out of our hospitals at a time when we need to massively reinvest in our public health care system. We have a government that is publicly committed to passing a Canada Pharmacare Act. We have a roadmap in the Hoskins report that lays out clearly how we can do it and how we'll save billions in the process. And yet, progress on implementing Pharmacare has been excruciatingly slow. Why is that? We've looked at the lobbying records and we see the beginnings of an answer to that question. In the 9 months following the supply and confidence agreement that was signed in March 2022, lobbyists from the two industries that stand to lose the most from a public pharmacare plan have lobbied the health ministry 150 times. 150 times in 9 months. That works out to 3 to 4 meetings every week during the entire 9 months. 3 to 4 meetings per week, every week. That is a staggeringly high rate of lobbying. It's 4 times more lobbying than Big Pharma has been doing in the pre-pandemic period. It's 5 times the amount of lobbying that the insurance industry has typically done. And so when we're trying to think why Pharmacare is not moving forward when it's so clear that it would benefit so many Canadians, I think the answer is clear. It's not because some provinces don't want it. It's not because it's fiscally unfeasible. It's because Justin Trudeau and his government continue to cave in to these corporate lobbyists instead of listening to the vast majority of Canadians who want Pharmacare. And so we're here today to launch a broad national coalition that's going to fight for Pharmacare, because we know we won't get Pharmacare unless we fight for it. We are going to bring forward the voices of patients who have been ignored by this government and who are still struggling with the high cost of drugs and with going without treatment as a result of the lack of a public drug insurance plan. We are going to organize to make sure that these voices are heard and that we get the Pharmacare we need now. Thank you.
Thanks, Nick. My name is Bill Swan. I'm the founder of Faces of Pharmacare, which is actually a grassroots patient group. Let me tell you a little story. It wasn't until 1987 that I realized that our Canadian healthcare system was fatally flawed. That's when I first learned that I had a pre-existing condition. That's asthma, severe asthma, and I couldn't get private drug insurance at all, no matter what I did. So I stopped taking my meds, ended up in the ER 4 times that summer, and spent a lot of time thinking about how much it cost to be in the ER versus how much it would have cost to get me my meds. I also realized that the Canadian drug system is exactly like the American health care system in total. If you're very poor, if you're elderly, or if you have a really good job, you're covered. Otherwise, you're out of luck. 35 years on, and nothing has changed. So in 2017, I started Faces of Pharmacare to bring the stories of patients suffering through this lack of a system. And I was asked to actually collate and curate all the stories for the Hoskins Commission. And let me tell you, it was one of the most humbling and dispiriting experiences of my life. Here's what I learned. Canadians, just like Americans, routinely get denied insurance because of a pre-existing condition, lose jobs because of high-cost meds, navigate complex funding pathways while they're seriously ill or dying, have to choose between living necessities and drugs every day, have to choose which condition to treat every month, face medical bankruptcy, move provinces just to access the drugs they need. They forego insurance altogether because of the high cost and, frankly, really poor benefits that are available. They have difficulty accessing insurance if they're in the gig economy. Just think about everybody under 30. They stretch supply of drugs, and I'm talking about insulin, just to make it to the end of the month. They select employment based on benefits, and they stay in bad employment for the same reason. So what I know, our patchwork system of drug coverage is an abject failure and must be replaced. If a healthcare system excludes just one Canadian to save a buck or to make a profit, that system is wrong. And National Public Pharmacare right now could reduce the burden on our ERs and make a difference. Thanks.
Now we're going to go to Monika Dutt on the Zoom.
I don't know if you heard that, Monika, but
Yes,
go ahead.
I did. Hi, everyone. I'm sorry that I'm not able to join you in person. As a family physician and a former chair of Canadian Doctors for Medicare, it is hard to see my patients struggle to afford their medications. I had a patient last week, a woman in her 40s with high blood pressure with a strong family history of heart disease. We've been trying to find a blood pressure medication that works for her so she can try to prevent a heart attack or a stroke. She earns just enough from her low-wage job to not qualify for provincial drug coverage, but she has no benefits. I had to work with the pharmacist to find the medication she can afford, which is not the one that is best for her. And these kinds of discussions happen over and over across the country, and too often people just don't take their medications. We know that there are over 100 government-run drug insurance programs and more than 100,000 private drug insurance plans in Canada, making our system both inefficient and costly. We've also seen with societal shocks like the pandemic how unstable it is to attach needed medical care to employment, especially when so many precarious workers already lacked insurance. Additionally, we know that women and people who are racialized are less likely to have insurance, that lower income households are more than twice as likely to be uninsured or underinsured as those with household incomes over 100,000, and that women are more likely to report being uninsured or underinsured than men. Instead of a comprehensive universal Pharmacare program that would be both cheaper and better, options like a portable benefits plan is being proposed in Ontario, and yet another fill-the-gap measure rather than a long-term solution. For decades, people across Canada, policy experts, reports, and advisory groups have been recommending universal national Pharmacare. The best time to do it is now. At a time when our healthcare system is under immense pressure, we need leaders to put forward a visionary program like universal Pharmacare to keep people healthy. Thank you.
I don't see any questions right now, so if there's anything else you guys would like to add, now would be the time.
Will Sophie be talking?
Marc-André.
Sophie can talk.
Yes, maybe I can speak a bit about the situation in Quebec. Je vais le faire en français, ça va être plus simple pour moi. Donc, on appuie la coalition, tout ce qui a été dit. Puis la situation au Québec, des fois, les personnes vont penser que c'est mieux parce que c'est un système hybride, mais finalement, on se ramasse avec les mêmes problèmes qui ont été nommés. Il y a plusieurs médicaments qui ne sont pas couverts par l'assurance publique au Québec. Puis chaque fois qu'on peut avoir accès à une assurance privée, légalement, au Québec, on n'a pas le choix d'adhérer à une assurance privée. Fait qu'il y a beaucoup de personnes qui se retrouvent obligées d'adhérer à une assurance privée. Puis présentement, depuis plusieurs années, les coûts explosent. Ça fait moins d'argent pour les gens d'investir dans d'autres choses, dans leur santé, de se payer de la nourriture de base, des soins de base. Et puis, il y a même certaines organisations qui abandonnent leur couverture d'assurance privée, invalidité et compagnie, parce que le coût des médicaments fait en sorte que les assurances coûtent trop cher. Donc, ça a vraiment des impacts au-delà même de l'assurance médicaments. Nous aussi, ça fait plusieurs années, la coalition, qu'on travaille sur l'assurance médicaments, puis c'est vraiment le temps maintenant de mettre ça en place, là, parce que c'est une situation qui est insoutenable pour tout le monde au Canada et au Québec.
And if you have nothing else to add, this concludes the press conference.
Marc-André.
Je ne suis pas obligé, mais peut-être juste certains éléments qui seraient importants à mentionner. Lorsque vient l'assurance médicaments, une des questions qu'on entend souvent, mais c'est comment est-ce qu'on va payer pour ça? Est-ce qu'on va augmenter les taxes, comme si les taxes, c'était quelque chose d'épouvantable? Quand on veut réduire les taxes, l'idée, c'est qu'on veut augmenter le revenu disponible des ménages. Il faut comprendre, un régime public universel d'assurance médicaments, ce que le directeur parlementaire du budget, ce que les différentes études ont démontré à travers le temps, c'est qu'on parle d'économie pour l'ensemble des Canadiens de 20 % en médicaments. Donc, d'une part, on parle d'une meilleure couverture pour l'ensemble des Canadiens et on parle d'économie générale de 20 %. Là, maintenant, oui, il va falloir qu'on paie ça d'une façon ou d'une autre. Donc, oui, il va falloir qu'on aille chercher une taxation quelconque. Les économistes David McDonald, Toby Sanger avaient démontré qu'en fait, il y a moyen, par exemple, avec une combinaison à la fois de taxes corporatives, à la fois peut-être de prélèvements sur les salaires, d'organiser ça de manière à ce qu'au final, l'ensemble des foyers canadiens puissent économiser. Donc, si on parle d'augmentation de revenus disponibles de l'ensemble des foyers canadiens, c'est l'équivalent d'une baisse de taxes pour tout le monde. Quand on demande une baisse de taxes, on veut augmenter le revenu disponible. C'est exactement ce qui va se produire ici, tout en assurant un meilleur accès aux médicaments pour l'ensemble des Canadiens. Il faut comprendre, là, on a un système en ce moment qui est complètement fragmenté, un système qui est très facile à gamer, si on me permet l'expression, pour différentes compagnies. Et à partir de là, si on veut se protéger contre les stratégies promotionnelles des firmes, par exemple, contre les demandes de certains assureurs, à ce moment-là, il faut avoir un système solide, il faut construire les capacités institutionnelles nécessaires pour protéger la population canadienne contre les stratégies de profit qui sont en place en ce moment. Merci.
Merci beaucoup.
All right. Thank you.